Recently, with the new advanced technologies coming in, robotic-assisted surgery has been in trends, and we have adopted these robotic surgeries for total knee replacement in Island Hospital. So far, with the guidance of robotic-assisted surgeries, we as a surgeon are more confident in performing these surgeries, as we know with the robotic assistance, we know the real-time feedback during the operation. A lot of people believe that robotic assisted surgery is the robot who does the surgery, whereas in the total knee replacement surgery is different. The surgeons are still fully in control of this surgery, but with the guidance of robots, we know exactly the alignments of the patients. In fact, every individual's the anatomy and the alignments of the knees are different. So with the help of robotics, we do know the exact alignment and the best alignment for these patients during the surgery.
I'm glad that you had that distinction made between robots not being fully autonomous, but being actually fully guided by us. And at the same time, reciprocally, we are also guided by the robot as well. So it's a very symbiotic relationship.
As an arthroplasty surgeon that have done many total knee replacement, I think this is the only time that we can actually basically objectively look at our work. Sometimes what we see and what we do, is very subjective. Although we are saying that we have many tools to assist us, but not until the robot came about. And now the robot, the main difference is they actually digitalize all the data. So we can, with all this digitalization of the card, the execution actually become very objective. That means it actually convert to precision. Very accurate bone card, and hopefully with that, definitely it actually result in a better outcome for the patient.
And with the robotic assistance, we do know how much bone we need to cut, and we should cut as minimal as possible. And the accuracy of the implant placement will be improved to 0.5 degrees or even 0.5 mm. That's how accurate we can go for. And the more accurate for the implant replacement, it means the longevity of the implant will be prolonged.
The latest machine that actually we had in Island Hospital, I would say that it's a bit different from the first generation. Nowadays, the machine, the benefit is we actually have what we call an imageless machine. That means we don't really need a pre-operative CT scan or some special X-ray to assist us before the surgery. This actually cut down our pre-operative preparation, and also it reduces the patient exposure to radiation. And for the extra benefit is even cut down the cost of the robotic assisted knee surgery. And then other benefit that we have for the latest machines is actually the machine size itself is also more portable and smaller. So previously, when the first generation of a robotic came about, there's a lot of huge machine that we have to actually a bit difficult for the team, to work. They have to push the machine around. But the latest machine we have in Island Hospital actually is a smaller version. It's actually mounted to the bedside, so that actually eases the workflow. So the surgery become more fluid and it's a shorter operating time.
I think it's important to shorten the time of operation so that to reduce the risk of the patients under anesthesia.
Yeah.
So these are all the considerations that are in place when we talk about robotic assisted surgery.
And the shorter the surgery usually means the lower risk of infection. Usually people have this perception that robotic assisted surgery is expensive, okay? But I think it doesn't really that important nowadays because with the advancement of the machine actually and the cut down of the pre-operative imaging, okay, actually it's not that expensive actually.
Where we spend more on the robotics, we actually save in other sectors as well. So it is thinking of a push and pull combination. At the end of the day, it more or less equalizes what we had before.
I think the most important thing for patients to consider is it's a safer operation, and it offer more accuracies in the implant placement and thus longevity so that the implant can last longer, and also patient will be able to walk earlier with less pain post-operatively. I think these are the benefits of robotic-assisted surgery.
I think between the three of us, we have almost about 80 years of collective experience doing knee replacement surgery. And I think if you combine these 80 years with a very quantum leap technological advance, that becomes a very, very significant in terms of outcome. And I think at the end of the day, no matter what the robot choice may be, I think that final selection depends upon the surgeon who is operating. He or she will be able to dictate suggest which robot would be best for the patient, depending upon the patient's unique physical characteristics. And it doesn't really come out to the choice of a particular robot. It can be any of the robots that are now at the forefront of technology. But at the end of the day, the surgeon has only one goal, and that is there must be a better outcome for the patient.